As we get older, staying informed about our health becomes more important than ever. But what most people don't realize is that some medical tests we relied on for decades can actually become harmful after age 70. This doesn't mean ignoring your health or refusing medical care. Instead, it means understanding how the risk-benefit balance of screening changes with age, and why certain tests that made sense at 50 may no longer be helpful or even safe at 75. Screening tests are designed to detect problems before symptoms appear, but that only helps if you are healthy enough to benefit from early treatment. Many conditions, especially cancers, grow slowly, sometimes taking 10 to 15 years to become dangerous. After age 70, especially with other health conditions present, that timeline often doesn't match the expected benefit of screening. This idea is known as lead time bias, and it's one of the biggest reasons unnecessary testing increases with age. The medical system rarely explains this. In fact, many people feel pressured into repeated tests because that's what they've always done. But data from the U.S. Preventive Services Task Force, USPSTF, and numerous clinical studies show that more testing does not automatically mean better health. After a certain point, unnecessary screening can lead to false alarms, invasive procedures, complications, stress, and costly cascades of follow-ups that offer little or no benefit. Another important concept is the harm-benefit ratio. When you're younger, the benefits of screening far outweigh the small risks. But in your mid-70s and beyond, the risks, like anesthesia complications, bleeding, overdiagnosis, or radiation exposure, can become greater than the potential benefits. Many older adults also don't realize that every test has psychological consequences. When a scan or blood test shows something abnormal, even if it's harmless, it can shift how you see yourself, from a healthy person to a patient. Research shows this nocebo effect can lead to real anxiety, decreased activity, and poorer quality of life. The goal after 70 is not aggressive disease hunting. It's protecting function, independence, comfort, and quality of life. That requires personalized medical decisions based on real evidence, not habits, fear, or pressure. In the next sections, we'll break down the 5 tests most likely to cause harm in older adults: colonoscopy, mammograms, PSA testing, unnecessary MRI/CT scans, and whole-body CT scans. Understanding these risks will help you ask better questions, avoid low-value care, and take charge of your health with confidence. Let's begin with one of the most surprising topics: colonoscopy screening after age 75. For decades, colonoscopy has been considered the gold standard for detecting colon cancer. It's a powerful tool for younger adults because it can remove potentially dangerous polyps long before they turn cancerous. But after age 75, the picture changes dramatically. Colonoscopy preparation is physically demanding. The bowel prep can cause dehydration, electrolyte imbalances, and even falls, a leading cause of hospitalization and disability in older adults. Sedation becomes riskier with age, especially for those with heart disease, diabetes, or frailty. Complications like bleeding or bowel perforation, while uncommon, increase steadily every year after age 70. And here's something the public rarely hears. Most small polyps found in older adults grow so slowly that they pose little real threat. Many people are sent back for repeat procedures every 3 years, even though the likelihood of benefit drops sharply with age. The USPSTF recommends routine colonoscopy only until age 75, with individualized decisions between 76 to 85, and recommends against screening entirely after age 85. That doesn't mean no one over 75 should ever get screened, especially those never screened before or with strong family history, but it does mean the decision should be personalized, not automatic. A similar pattern appears with mammogram screening in women over 75. Regular mammography reduces breast cancer deaths in younger women, but trials rarely included women older than 74. That means evidence is weak for routine screening beyond that age. False positives become more common, leading to callbacks, biopsies, and weeks of anxiety. Even more concerning is overdiagnosis, detecting cancers that are real but so slow-growing they would never become dangerous. Studies estimate 30 to 50% of breast cancers detected in women over 75 fall into this category. Once a cancer is found, treatment pressure becomes intense. Yet surgery, radiation, and hormone therapy are often harder on older adults than the disease itself. For healthy, active women in their early 70s, mammograms can still be appropriate. But for those with multiple chronic conditions, the harms may outweigh the benefits. Both colonoscopy and mammography illustrate the same truth. After 70, screening must be individualized, guided by personal health status, life expectancy, and preferences, not outdated one-size-fits-all guidelines. Prostate cancer screening with the PSA blood test is one of the most controversial topics in men's health. The PSA level can rise due to cancer, but it also rises from benign conditions like inflammation or an enlarged prostate, both extremely common in older men. This means the PSA test has a false positive rate approaching 50%, creating fear, unnecessary biopsies, and treatments that often do more harm than good. Autopsy studies reveal an astonishing fact. About half of men over 70 have prostate cancer cells in their prostate, but the vast majority of these cancers are so slow-growing that they would never cause symptoms. Yet once PSA is elevated, the diagnostic cascade begins. Men are sent for prostate biopsies, invasive procedures that carry infection risks, bleeding, and, in about 1% of cases, hospitalization. With rising antibiotic resistance, biopsy-related infections are becoming even more serious. If cancer is detected, even very low-risk cancer, many men feel pressured into aggressive treatment. Surgeries like radical prostatectomy and treatments like radiation can lead to lifelong side effects. Urinary incontinence, erectile dysfunction, bowel problems, and chronic pain. For many older men, the treatment harms far exceed any benefit they might receive. That's why the USPSTF gives PSA screening for men over 70 a grade D recommendation, meaning experts believe the harms outweigh the benefits. But this doesn't mean ignoring prostate health. Men should still be attentive to new urinary symptoms like difficulty urinating, blood in urine, or unexplained weight loss. These signs require evaluation. What's unnecessary is routine screening in men who are unlikely to benefit. For younger, healthier men in their early 70s with a strong family history of prostate cancer, PSA testing can still be considered, but only after a clear discussion about the risks of downstream procedures. An increasingly common alternative is active surveillance, monitoring low-risk cancers with periodic labs and exams rather than jumping into treatment. The key is informed decision-making. PSA results alone should not dictate the course of a man's life. Understanding the natural history of prostate cancer, and the dangers of overdiagnosis, empowers older men to choose care that protects both longevity and quality of life. Back pain becomes common as we age. Arthritis, degenerating discs, muscle strain, and wear and tear are part of life. But many older adults don't realize that imaging tests like MRIs and CT scans often do more harm than good when ordered too quickly. Most episodes of back pain improve on their own within 6 to 8 weeks. Yet doctors often order MRI scans early, believing they're being thorough. What they don't explain is that nearly every scan in older adults shows abnormalities, bulging discs, bone spurs, narrowing of the spinal canal, even in people with no back pain. These are normal age-related changes, not necessarily the cause of pain. But once the patient sees these findings on a report, anxiety spikes. They believe something is seriously wrong. This often leads to referrals to surgeons, pain specialists, or injections, even though many treatments offer little long-term benefit. In fact, studies show that patients who receive early MRI imaging are 12 times more likely to undergo back surgery, usually unnecessarily. The psychological effect is also significant. Being told your spine looks abnormal can make you fearful of movement, decreasing activity and prolonging pain. This is a classic example of the nocebo effect, belief causing physical worsening. That doesn't mean imaging is never needed. Certain red flags demand immediate attention. Severe or worsening pain, progressive weakness or numbness, loss of bowel or bladder control, history of cancer, fever with severe back pain, or unexplained weight loss. In these cases, imaging helps detect serious problems like fractures, infections, or tumors. For everyone else, conservative care is far more effective. Physical therapy, gentle movement, stretching, strengthening, and staying active. These strategies improve long-term function far better than early imaging or unnecessary surgery. The bottom line is simple: scans should support diagnosis, not drive it. A normal age-related change on MRI shouldn't turn a manageable backache into a medical crisis. Avoiding unnecessary imaging protects both physical and emotional health, reduces exposure to radiation, and prevents being pulled into a cycle of medical interventions that were never needed in the first place. Whole-body CT scans have become heavily marketed as executive checkups or peace-of-mind scans. They claim to detect hidden diseases early, but the truth is that these scans expose older adults to large doses of radiation and uncover abnormalities that usually mean nothing. For example, small lung nodules appear in 15% of people with no symptoms. Kidney cysts appear in more than half of adults over 50. These incidental findings trigger follow-up scans, specialist visits, biopsies, and months of unnecessary worry. This chain reaction is known as a cascade of care, and it often leaves people worse off than before the scan. That's why no major medical organization recommends whole-body CT screening for healthy adults, regardless of age. The real goal after 70 is not to uncover every possible abnormality. It's to protect independence, mobility, mental well-being, and quality of life. That means prioritizing meaningful, high-value medical care, not high-tech fishing expeditions that lead nowhere. Taking control means asking the right questions when a doctor orders a test. What are we looking for? How will this result change my treatment? What are the risks of false positives? Are there safer, less invasive alternatives? What happens if we simply monitor instead? This approach is not refusing care, it's smart health management. Family members also play a key role. Adult children should support, not override, the wishes of older parents. Bringing someone to appointments can help capture information, ask questions, and ensure decisions reflect the patient's values. The movement in modern medicine is shifting toward shared decision-making, where the doctor and patient work together as partners. Older adults deserve respect, autonomy, and the confidence to make choices aligned with their priorities. Empowered aging means choosing tests and treatments that truly improve life, not blindly following outdated routines. It means understanding that doing less can often protect you more. And it means remembering that your health, your time, and your peace of mind are yours to protect.